Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1802nd day of uninterrupted daily webinar of Ifph. And today we are going to have a very great session, discussion on integrated systems of treatment. And we do have a great panel with us. Dr. Kathy May Lemon from USA, Dr. Beatrix Dessner from Germany, Dr. Marian Salcedo from Bolivia, Dr. Huan V. Ling from Brazil, and our Vice President, Dr. Shaji Varghese Kudiat from India. And we are having a great session. After the discussion, we will be having an open round with all the members. So first of all, I'd like to welcome Dr. Shaji Varghese Kudiat, our Vice President from India, practicing at Philippines, and the founder of DSA, Dynamic Scientific Approach for the Prevention, Treatment, and Rehabilitation of Cancer and all chronic diseases. Sir, I welcome you to start the session. Sir, you can unmute from your side.
Thank you, Dr. Vindiraj, for this wonderful for the session and the invitation. And today, all over the world, the word very frequently heard amongst doctors is integration. Integration of different system of medicine is an essential thing. But the thing is that integration of what? Is it integration of different system of medicines, or is there any particular scientifically oriented strategy to integrate? What to integrate? How to integrate? These are the things we need to discuss and understood in detail so that the integration of whatever needed become beneficial to the patient. Today, the word integration is generally used to mix up different systems of medicine. For example, the conventional medicine is integrated with the homeopathy and other systems of medicine, and they call it complementary medicine to remove the side effect of their medication and as a supportive treatment to remove the complications of their treatment like that. But I don't think that is the needed integration. I don't think the conventional medicine of today is eligible to be considered as the mainstream medicine, even though they are. There is no scientific validity and there is no usefulness of such a system of medicine for the benefit of the patient. I am not talking against the conventional medicine. We need that also. But we need to judiciously apply the benefits of the conventional medicine of today appropriately, where we can easily find that today's conventional medicine, which is applied everywhere, is most beneficially, scientifically, and appropriately used for overcoming crisis, accident patients, managing accidents, and purely surgical cases. So only in such cases, this conventional medicine is applicable to be most beneficial in a most beneficial manner. But it is the mainstream medicine, everything they are funneling to their side. But that is very detrimental to the benefit of the patients and dangerous. It is not a curative management. So it never cure any diseases. So that is what we should understand and help the world to realize. But the pharmaceutical companies who invested big money are definitely our contradictors and opponents of such a philosophy. So they at present they are not agreeing to restrict their power and influence and application everywhere. So what we need to do is creating awareness among the patients. So in my opinion, whenever a patient gets sick, the immediate application of the medication should be natural, side effect free, and holistic science based. And the holistic science should be the fundamental basis for medical science and its researches. Merely studying the physical body alone is only one third of the scientific consideration of the living totality or living phenomena, which is composed of both the dynamic components and the physical component. So, merely studying the physical plane alone and applying medicines that influence the physical plane alone is never going to succeed in curative management. So, for me, integration is something which involves influencing the entire components, that means mind, body, and vital force together. Then only there will be rectification of pure damages happen to the every component associated with the diseases, bringing back to complete normalcy. So that includes yoga, meditation, proper counseling to understand and modify the concept and attitudes of our mind that lead to thought generation. Because I am, as you may know, I am introducing a new scientific hypothesis called dynamic science that explains how the mind, vital force, and DNA are interconnected. And my research conclusion is that our DNA is mostly regulated by the thoughts we allow to generate in our mind. And our thought generation is ultimately governed by the concept and attitudes we keep. So if our concept and attitudes are corrupted, definitely there is a big problem. And nobody is considering that and minding the mind, especially the concept and attitudes that we keep. Today, the world is totally governed by corrupted, unnatural, unhealthy concept and attitude. That is the total devastation happening, resulting into so many unhealthy, incurable chronic disease development. So integration should be targeted in resulting into correction of the entire components that constitute life, that includes the mind, in rectifying its unnatural, unhealthy concept and attitude back to normal, a healthy plane, and also purification of our vital force that needs meditation, including prayers and right thought process. All these are very fundamental. Then energy medicines like homeopathy is most important, and that is the future scope of homeopathic system of medicine, which I honestly believe will become the mainstream medicine in near future, less than 50 years. I am confident and sure of that. As if we will be able to make the world understand what is the right way to design a treatment process for the benefit of the patient. Today, the benefit of the patient is never looked into, and so the the advantage of the multinational pharmaceutical companies and their financial benefits are the only benefit the medical systems are looking into, and that is the danger. So integration should be scientifically guided. Scientifically means that includes the entire components that constitute life, from where the causes of diseases needed to be looked into. So when we do that, the rectification of every possibility to destructively damage the every component that constitute life will be able to identify and rectify, whereby complete cure become possible. That's why many diseases today are remaining incurable and they legally declared it incurable. If somebody speak about it is curable, that is punishable today in many countries. And they treat it only in the physical plane, and diseases go on aggravating into incurable conditions because the root of the matter is never touched into or looked into or never get rectified. So that persistence and sustainability of such causes will progress the disease. We merely suppress the symptoms, whereby the patient feel an artificial normalcy. Some of them may get slightly well. Some of them even get cured because of the ignorance and the positivity resulted from that feeling of normalcy, placebo effect. And but most of the cases, there is progress of the disease to higher and higher planes, even though the symptoms are suppressed. That's the reason why many patients, these people are thinking of euthanasia or mercy killing because of their unscientific approach towards understanding a patient and disease. So integration is needed, but it should be directed and targeted to the entire components that constitute life, and where holistic science should be the scientific basis for that. So we are the people to understand it and teach the world about it. So IFPH is designed to do such a great thing. We all are together here to establish and educate the world about it. I hope we will be collectively able to do it in our lifetime so that the future generations will be able to enjoy better health through our efforts. With this, I wind up. If I get any questions or anything, I will be able
Yeah,
to.
we will be getting back to you, sir. Thank you for the opening remarks, and we are going straight to Dr. Beatrix Dessner from Germany, specialist in dermatology, pediatrics, and general medicine, practicing homeopathy from the past 22 years, and coordinator of IFPH at Germany. Let me welcome Dr. Beatrix Dessner. Doctor, please.
Okay, thank you very much, Dr. Vinduraj and Dr. Shaji. I totally agree with your thoughts and your words. And I also agree with your vision. It will be soon that homeopathy will be spread more and more. And also IFPH is taking part of this development. And well, as Dr. Hahnemann in his time, he was really hating allopathic medicine of that time. It was so terrible. It was so difficult. He was really, really like destroyed. He stopped being a doctor. So he really, really invented a new system, an energetic system, a friendly system, which we call homeopathy. So as we today are talking about integration, let us be practical. As I am an example of a person, of a medical doctor, who was trained with allopathy. I had 6 years of studies. The last year, I was working 5 or 6 years in the hospital, different specialties. So, but I can say from the beginning on, from the first day on studying medicine, I felt something is missing here. The soul is missing here. The first days we had to go to anatomy and had to have special histology and biochemics. My soul always felt that's not the way I would like. So I was very lucky during my studies. I met homeopathy outside the university and I did start. So, but today I can say, since more than 30 years, I'm working as a general doctor using homeopathy mostly, like 90%. But also the patients come to me because they know that I know both sides. Here in Germany, we have that system. And if you like, I could show you a case to explain how we integrate here in Germany allopathic medicine and homeopathic medicine. So if I could share the screen, you see the patient? Yes?
Yeah.
Okay, yes. It's a young woman, 31 years old, teacher of sports and German. And the diagnosis is not so very nice. She has a systemic lupus erythematodes. And she has joint pains. And what is very bad, she also had strong kidney affections with hypertension. She already had to go to the emergency ward. So, as Dr. Shaji also was explaining that the soul and the thoughts are so important, and I totally agree, Dr. Shaji. Let's look at her mindset. So, 2 years ago, she developed joint pains and fever attacks when she was starting her practical part being a teacher. It's called internship. By the way, the case will be 3 or 4 minutes. It will not be very long, but to understand the basic. So this meant a lot of stress for her because she's a perfectionist and has strong anxiety of failure. These two components make a lot of stress. Originally, very important, she was interested to study medicine. She wanted to become a doctor, but her parents, both teachers, advised her also to become a teacher because this will be more secure. So we feel the mindset in that family: security, perfectionism, don't make a failure. And because of the stress at school, she had sleeping problems and regularly woke up at 3 o'clock in the morning, brooding about her problems, and there was a clear ambivalence concerning her profession. So with 33 years, she is ambivalent with her profession. That is not so nice. So if we see the rubric, we will see it later also, we have some interesting remedies. She has pains in different joints, especially in the knees. And this is a big problem because she's teaching sports. She cannot show the children how to do the sport activities. And she also has pain in her right wrist and cannot write very well. It's also a big problem for her. And at the moment, she has to take 10 milligrams of cortisone every day. Last summer, she had a severe crisis with kidney problems. She developed strong swellings in her legs and had to be treated at the intensive care. Family history, also autoimmune diseases like rosacea, Bechterew, Parkinson. I could have it for you more clear like this. Okay. So if we look at the rubrics, I was doing the repertoire, I was surprised. I saw calcium carbonium as the first remedy. But if we see the perfectionism, waking up at 3 o'clock, having swelling, kidney problems, joint problems, okay, I said, and there's a little rubric, antagonism with himself, also calcium carbonicum. I said to myself, okay, I will try. And here now it's a basic sheet, a very important sheet for today. She's taking 10 milligrams of cortisone. She's taking methotrexate. It's also a strong remedy, anti-inflammatory, and she's taking antihypertensiva, strong remedies. So and that's the point. Here we start the combination with allopathy and homeopathy. She has, at that moment, she has to take these allopathic remedies. But now we start with the homeopathy at the same time. So I started with calcium carbonicum, LM, twice a day, 5 drops. Why LM? Because it's more easy with chemical drugs to support the patient with homeopathy. I have a lot of experience with these cases. So now, very, very special, quasi incredible. After 6 days of taking the same allopathic remedies and taking the calcium carbonicum, the sleep is better. She wakes up, and when she goes to the toilet, she can sleep again. The sleep is better. She doesn't think so much about her problems. She feels more confident. So, as Dr. Shadi is right, the first amelioration we can see in the mindset. Something more quiet here. And the joints, interesting, the stiffness is also better and she can reduce the cortisone just after 6 days, 1 week. Very impressive. And also the urination feels better. So we were very positive. We did go on with the remedy. And 1 week later, mainly after 2 weeks now, she feels well, good energy. Very important. The joints feel more soft. The blood pressure went down and she can reduce the antihypertensives. This is very impressive. Of course, not all of our cases are like this, but here we see the remedy is very, very good for her. So we did continue twice a day, 3 weeks after the treatment. After half a year, now for the first time, she starts to work again. She has more energy with a few hours and long-term follow-up. Now she has 1 year of experience at school. She was able to work for 1 year. During the years, she was improving, was able to work. She can make decisions more quickly. And to the astonishment of her specialists, the kidneys kept silent and safe. Okay, so I think I can
Excellent.
get over, yes,
Yeah.
get over to the next person talking.
Yeah, we will
I would
talk.
have more cases,
Yeah, we will
but
find
okay.
more time to
Yes.
share more thoughts with you. And it's
Mhm.
time to have Dr. Kathy May Lemon with us from USA, the founder director of HPWWC, a worldwide service and choice for disease prevention. Let me welcome Dr. Kathy May Lemon. Doctor, please.
Thank you. Thank you very much. And I'm very pleased to be able to present here, share a few thoughts with you here. It's been a long time. This has been a very, very difficult year for me in many ways. So again, I'm very, very pleased to be able to share with you. Let me try sharing a PowerPoint. And I think I'm going to fly through this because there's a lot that I can share. Are you seeing the PowerPoint?
Yes.
Okay.
It's not. Yeah, it's now.
Yeah. Okay. Good. There's just so much because as Dr. Shaji shared, we are at a turning point. We are at a time, a very good time. And I think it's going to be very important for us to realize what we have in homeopathy and what we're really facing, like Dr. Beatrix, as you also have shared. So we need to remember, as Hahnemann shared, no individual has done more good to the medical profession than Samuel Hahnemann himself. Okay, whoops. Now what's going on? Okay. So yeah, and here's the mess that we're looking at today. And what are they saying? What about trying homeopathy? That's the mess. I'm sorry, I've got to. That is where we are, what we are facing today, and what common medicine is afraid of. But when we look at this integrative, what does integrative mean? Let's look at what we're really looking at as we're working to integrate. With medicine around here, I did a bit of research just so I can understand exactly what we're talking about and what's being understood outside of homeopathy as far as integrative. And I found this, it's a very long explanation shared by a school in Arizona. All factors that influence health, wellness, and disease are taken into consideration, including mind, spirit, and community, as well as the body. This is their writing, not mine. And you can go ahead and read through this if you'd liked, but I especially noted what I've highlighted here. Integrative medicine neither rejects conventional medicine nor accepts complementary therapies uncritically. We have to be cautious. We need to be aware of things. But most importantly, we need to realize what we have in homeopathy. There is a societal problem. Conventional drug pharmaceutical companies, they provide products that they can make a lot of money from when sold. This is a big thing we're the United States. They've essentially lost sight of the idea of actual healing. The influence that they have upon a sickened society that wants to be well has become intense. And I'm very, very grateful for the change that's happening right now in the country where I live. And especially, of course, since 2020, we all know what happened then. people are saying even louder, ever louder, we have had enough. Good conventional doctors are finally stepping forward once again to actually help mankind. This is something that we in homeopathy have always been doing. All right. And let me, what I present, what I share with you in these few minutes that I have here, be testament to the fact that now is the time to find a way to effectively work or become integrated with conventional medicine. Now, I'm going to get into so much more. One needs not be exclusionary of the other. I hear your stories like yours, Dr. Beatrix, how you learned of homeopathy like Hahnemann did, and you found a better way. But one needs not to be completely exclusionary of the other. Conventional medicine has its place, especially in cases of emergency. But they've gotten to the case that there are so many specialists for this and that and the other thing that they actually have lost their focus. There's also chiropractic, osteopathic medicine, which is absolutely necessary. We have a wonderful chiropractor that we see once a month, just because keeping the proper alignment of the bones is essential for health. There's the idea of a nutritionist. Now, I've seen so many grossly overweight nutritionists over here trying to tell me how I should eat. I'm sorry, but no. You are basically what you eat. We need to have a holistic view and realize that good nutrition is absolutely essential for full health. Mental health, as it has been discussed, it needs to not be a taboo subject. It must be cautiously approached, but medications are not the only means for treatment for this. Sometimes it is essential, again, as in conventional medicine, in extreme cases, but medications are not the only means of treatment for this or anything. Let that be resoundingly clear for us here. And here's a book that I'm going to highly recommend. It's been talked about here, Sane as Silence by Jerry Cantor. It presents a solid presentation of homeopathy's long, rich, and successful history of working in healing mental illnesses. We've got such a gem here with homeopathy. The homeopathic understanding of health is so complementary. It is not an absence of disease, which is what conventional medicine today wants us to believe. Hahnemann says this in aphorism 9, the state of health, animating the material human organism, reigns in supreme sovereignty, maintaining the sensation, activities in all parts of the living organism in a harmony that obliges wonderment. We need to read this again and again. The reasoning spirit can bring this healthy living instrument to reach the lofty goals of human existence. Hahnemann loved this idea of health. He gets into it further in his lesser writings. He even touches on proper diet, proper movement. I'm not going to say exercise because movement, I live on a farm. There's a lot of movement that happens when you simply live on a farm. Things only within the latter part of the 20th century, though, that modern medicine has started recognizing are important to health. You got to eat well, and you've got to move. We are so fortunate that homeopathy has been presenting this all along. Now, so that we don't get arrogant or cocky, does homeopathy have all the answers? No. Does conventional or allopathic medicine have all the answers? No. Does any form of medicine have all the answers? No. So is abuse happening? Now, rhetorical, answer this yourself, but unfortunately, even in homeopathy, there are those bad apples who call themselves homeopaths, but they don't really understand what they're doing, or they don't understand the medicine that they're wanting to utilize. As we work for this integrative approach to work smoothly and effectively with other forms of medicine, the understanding of homeopathic medicine will increase and spread. Now, as I've addressed before, it's essential that we understand this now. It's not essential for us in homeopathy to know and abide by everything that conventional and allopathic medicine observes and works with. It's an issue that unfortunately the US FDA is working to make it very difficult for homeopaths here. But homeopathic medicine can and will and has stood on its own. It's solid medicine. Hahnemann himself said that he has no idea how certain things work, but he knew, as we today must know, that homeopathic medicine and its principles work. Now, this is what I really wanted to get to share with you today, a case study that happened just now with my husband. He woke up Thursday, the 24th of July, just a couple weeks ago, with a very very sore shoulder. We went to see our chiropractor that afternoon, early that afternoon, for an emergency visit. And while we were there, my husband nearly passed out 3 times because of the pain he was in. I have never seen him in this much pain. The chiropractor adjusted him. He was very good. He adjusted, made sure that the ball and socket, left shoulder were in place, and sent him home. I brought him home, but he was just getting worse until finally, I had to do it that evening. I brought him to a conventional emergency room, and there they x-rayed his shoulder, and guess what they found? Calcification of the tendons in his rotary cuff, a very painful condition that I was told could take months, possibly surgery to get over it. So they gave us, as was expected, him a steroid and our narcotic strength painkiller, and a recommendation to an orthopedic surgeon just because of the amount of pain he was in. Now, fairly said, I don't think that they really know or understand anything besides this. Well, when we got home, I immediately started doing my own research, including contacting several homeopaths. I had already been doing this, but now that I had a picture of it with this x-ray, with this conventionally provided x-ray, I started talking, and this is what I learned, and I'm not going to get into details with it here because it's not all homeopathic, but I learned of an ancient approach of a vinegar bath, which no details here, but vinegar dissolves calcium. And so he was doing this vinegar bath once to twice daily using olive oil after this for a kind of a lubrication, cell salts, including calc fluor, calc phos, taking these several times a day, high potency roost tea, and roost tea 30C as needed. And it was just 4 days ago that we returned to the chiropractor. He said several times, your shoulder, talking to my husband, is almost better than it was before this happened. He could hardly move. And here he was, his range of motion was where it normally should be. There was very little to any pain. The chiropractor took many notes about what I was doing with him. This is how integrative medicine needs to work. Now, I also, very briefly here, I had 2 major surgeries several years ago. I talked openly with a surgeon about homeopathy and what I do with it. She was very receptive and was very impressed at how quickly I healed. An element of trust. We've got to have that element of trust between us and the other forms. Last year, my oldest son, had to have an appendectomy, and it happened to be the same surgeon who performed this. Well, the day of his surgery, after they wheeled him down to the theater, the surgeon came and talked briefly with us, and I had some homeopathic meds that our son forgot to take. And so and she took them from me. She said, let me give them to him. So she brought them down and gave them to our son. Again, this is how integrative medicine needs to work. There's a lot that needs to come in play. Now, I can't go away without talking or addressing homeoprophylaxis just briefly, but that's what I do. Okay, highly effective means of disease prevention, homeopathically speaking, working to lessen the susceptibility of the body to the symptoms associated with many labeled diseases. It's something that totally changed the way Hahnemann practiced and researched homeopathy from the time he discovered it in 1799. It was highly researched by homeopathy through and into the 20th century. Its rate of effectiveness has been confirmed again and again, standing at about 90% when known exposure to disease has taken place. Now, should homeoprophylaxis compete with what is currently being done and promoted as the only means of prevention? Well, approach it this way. It is not there to compete. It is there and should be recognized, utilized, and promoted because it works. Informed choice, we need to let people know the options that are available. We need to let the people choose and honor the choice, whatever it is. But unfortunately, conventional allopathic medicine still wants to refuse to do this. With the stories that I continue hearing, and I just heard a couple more stories yesterday, I well know that my work with and for homeoprophylaxis will not come to any quick end. But I have no intention to slow down or quiet myself in any way. This is how integrative medicine needs to work. Now, one last thing I want to show you that I just saw yesterday. This came in an email from Homeopathy International called HINT. What they shared, huge growth is predicted for homeopathy. This is what we need to take and run with homeopaths. They predict that the US dollar, there was 9.82 billion US dollars spent on homeopathy in 2024. They are predicting now that by 2030, this should go up to almost $20 billion being spent on homeopathy worldwide. We need to grasp this and realize what we've got. And just the idea of integrative medicine is something that must be allowed to take over healthcare now. Okay, people deserve to know that they have a choice. Conventional or orthodox medicine does not and cannot have all the answers. They need to realize that. We need to embrace that. No single form of medicine ever can or will have all the answers. We must be very pleased with what we have always had in homeopathy and embrace this as we work to fully integrate with all forms of healthcare today. So thank you very, very much. I very much appreciate the time I've been able to spend.
Thank you, Dr. Kathy May Lemon. Excellent presentation. Yeah, it's time to move to Dr. Marian Salcedo, Bolivia, homeopathic physician, expert in phytotherapy. She is also the principal investigator at the Integrative Medicine Research Team, Hospital de Clínicas La Paz, Bolivia. Let's welcome Dr. Marian Salcedo. Doctor, you can unmute it from your side.
Thanks so much. It's an honor to address you today to reflect on a subject that demands deep sensitivity and, above all, a critical perspective grounded in evidence. The integration of all these medicines, including homeopathy, into contemporary health systems. So it's important to remember that we have a classification of certain sciences accepted by the World Health Organization. And also there are policies designed for the integration of medicine systems, therapies, and complementary medicines. So we as homeopathic doctors were including like complementary systems or health systems of medicine in this classification. But that is very interesting because in my opinion, I believe there are compatible sciences and incompatible sciences. For example, maybe it's compatible to join homeopathy with yoga or with meditation, according to Dr. Shaji told. I agree with that. But we are incompatible if we are doing an homeopathic treatment with an anti-allergic pills, for example. I think we should use technological advances to know our science even more. And there are integration policies, however, this integration does not occur in our practice. For example, in Bolivia, in my country, is a cultural behavior to use medicinal plants day by day in everything. Everybody knows how plants have to use in different illness. And we have that policy to include the phytotherapy in the health system. And now we don't have any results, and it's 15 years working on that. So there are therapies that are highly sought after in America and are relatively new, such as family constellations, transgenerational studies, biodecoding. And it's very interesting because there are some questions like as a healthcare professionals, I have to face. For example, how do I approach these new approaches in my practice and how I can integrate them? Because I have a lot of patients who come to my consultations and just told me, yeah, I have to heal the relationship with my grandfather because in my transgenerational study says that I am repeating his history and they are demanding for homeopathic treatments for that. So it's a big question for me. We live in an era where biomedicine has achieved remarkable technological diagnostics and therapeutic advancements. Yet we are also witnessing a growing interest among both the public and health professionals in more humanized, holistic, and participatory models of care. This interest has created a legitimate and necessary space for traditional and complementary medicines. We are in these classifications. But also I saw the present interest of homeopathy for students of homeopathy and patients. And this value goes beyond cultural or symbolic aspects and is increasingly being validated under contemporary research standards. So integrative medicine's focus in approach that enhances self-healing, actively promote prevention, and restore physical, emotional, mental, and spiritual harmony. This vision aligns with the person-centered care model promoted by the World Health Organization, which acknowledges the value of these kind of practices, and they are safe, effective, and culturally appropriate. So there are some strategies from 2014 until now, and it will be from 2030, where the World Health Organization advocates for the systematic integrations. Countries such as India, Brazil, Switzerland, Cuba have already developed public policies that regulate and integrate therapies such as homeopathy. And recently, Ecuador denominated homeopathy as a medical specialization. So we have a lot of troubles there because here in America, you have to study a medicine career. So you have the allopathic chip in your mind, and then you have to change that chip for homeopathic mind. And that jump is very difficult. So I have a lot of troubles with my students because they have to relearn new concepts in homeopathy. This is one trouble that we have. The second trouble is the research that they are conducting. So we have to align to the research that they developed, and our science cannot be studied in that way, in that form. We have to integrate a dynamic sphere of the human being and all the patients to really understand and carry out the studies that we need. But contrary to the common perception that homeopathy lacked scientific support, there are over 1,500 clinical trials and more than 200 systematic reviews indexed in databases such as PubMed and Cochrane. So it means that homeopathy can show the beautiful of that art and science in different kinds of scenarios. A systematic review published in Systematic Reviews for Matty et al. In 2014 evaluated randomized controlled trials in individualized homeopathy and found that the effects were greater than placebo, although methodologically heterogeneity was noted. And that is another big trouble that we have because we are always competing just with placebo. In 2018, the European Committee for Homeopathy presented a comprehensive summary of clinical, experimental, and epidemiological evidence supporting the effectiveness of homeopathy in conditions such as recurrent respiratory infections, sleep disorders, mild anxiety, dermatitis, irritable bowel syndrome, and rheumatological diseases. Furthermore, recent research in nanomedicines has conducted the presence of active principles nanoparticles in high homeopathic dilutions. So that is one of the best gifts that we have for your Indian researchers. So challenging the out-of-date argument that there is nothing in homeopathic medicines. Now we have this support of nanomedicines and nanotechnology. These findings, alongside studies in cellular and animal models, open new lines of inquiry into mechanisms of action through the lenses of quantum physics, epigenetics, and neuroimmune interactions. So now, more than ever, health must be understood as a complex, dynamic, and multidimensional phenomenon. The medicines of the future will not be solely technological or molecular. It must also be integrated consciousness and plural, including homeopathy and other complementary therapies in this vision. So it's not a regression to pre-modern models, but rather an expansion of our knowledge horizons in favor of human well-being. The key lies not in imposing one model over another, but in establishing respectful bridge of dialogue between knowledge systems, developing rigorous clinical research, and fostering interdisciplinary ethical and compassionate medical education. So homeopathy is not a trend or a cultural consensus. It is a coherent response to the human right to health, to need for personalized care, and to demand for safer, more accessible, and more human therapies. Science is not a dogma. It is an open, critical, humble, and ever-evolving attitude. Thank you very much.
Thank you, Dr. Marianne. And now it's the time to listen from Dr. Huan V. Ling from Brazil. Dr. Ling, born in Taiwan, raised and graduated in medicine in Brazil, specialist in infectious and parasitic diseases, expert in acupuncture, author of more than 230 publications about treatment of diseases, rebalancing the internal energy. Let's welcome Dr. Ling.
Hi, thank you for introducing me. I'm very happy to be here today in this celebration. I didn't prepare any data show to present, but I will present one article that I wrote about one big problem that's happening worldwide. I don't know if
Yeah,
sharing.
you're audible.
Can you see this article?
Yes.
Yes. Okay. This article was published last year, and it's about the history, a case of one case that I attending in 2023. And the title of this article was, "Can the medication we are prescribing cause myocardial infarction?" In this article, I'm showing that we are facing a new global immune deficiency caused by the influence of the electromagnetic radiation after the modernization of telecommunication. And due to this energy deficiency situation, I don't know if I can, yeah. The majority of patients nowadays are facing an alteration in the energy level of the five internal massive organs of the five element theory in traditional Chinese medicine. In a research that I did in my clinic in Brazil from 2015 to 2020, analyzing the energy of these five internal massive organs, this is the research, and it was published 2021, showing that 2021, I analyzed the energy of the 1,000 patients in my clinic in Brazil from 2015 to 2020. And the result of this study showed that the majority of patients were in the lowest level of energy in the liver, in the kidney, in the heart, in the lung, spleen, memory, and concentration, and only the spiritual chakra have energy at that time. But nowadays in 2025, 100% of all of us are in this situation, including the seventh chakra, the spiritual chakra, are without energy also. So this alteration in the chakras energy centers is studied by Ayurvedic medicine and demonstrated that this is a new form of immune deficiency that we are facing nowadays. It's not caused by HIV or the use of corticosteroids or immunosuppressor or chemotherapy medication, but is caused by this lack of energy caused by the modernization of telecommunication. So if we use any kind of high concentrate medication nowadays, we will reduce even more this internal energy that is altered, leading to complications. Because as you can see in this chart here in the bottom, you can see that the blood to circulate inside the blood vessels, according to traditional Chinese medicine reasoning, you can see that the blood needs to have yin and qi and blood. And yin and yang are two energies that we have in our universe and inside the body that is formed in the kidney, and qi is formed by the liver and the lung, and blood is formed by the spleen, and all this circulation is governed by the energy of the heart. And as we do not have enough energy in all these organs, if we use any kind of high concentrated medication, we will drop even more this internal energy and cause blood stagnation and can lead to a sudden death or myocardial infarction or thrombosis or strokes. And this is what is happening in the whole world nowadays, that we are facing daily cases of myocardial infarction, even in young adults and children's. And that is why we are in this group. This group is very important nowadays to increase the use of high diluted medication, because the use of high diluted medication can increase this internal energy that's already very low nowadays. And this is what we want. We need to disseminate in the whole world, that the medication of choice to be used in this new type of population that we are facing nowadays is only high diluted medication or homeopathy medication created by Samuel Hahnemann. But when you use high diluted medication, you need to see that, because the theory created by Samuel Hahnemann is treating these symptoms. But the theory created by myself, when I integrate the reasoning of traditional Chinese medicine with homeopathy and with allopathy medication, is that we need nowadays to treat the root of the energy alteration, that are the energy deficiency in these 5 internal mass organs of the liver, heart, spleen, lungs, and kidney, to prevent the formation of any kind of disease, including the formation of diabetes, anxiety, depression, diabetes, myocardial infarction, or even cancer, to increase the immune system of our population. So this is what I want to say in this meeting, to congratulate all the presenters and to congratulate this group for these efforts to disseminate the knowledge of homeopathy, the main medication to be used nowadays in this new global immune deficiency. Thank you for your attention. And if you have any questions, I'm here to answer.
Thank you, Dr. Huang Wheeling. And it's time to just have a roundup. And we had various suggestions, various viewpoints regarding these things. Doctors from various time zones joined here for the great cause and thought on integrative medicine. They're all about they are talking about the betterment of humanity. And it's time to have a chat with Dr. Manoj. Doctor?
Thank you, Dr. Binduraj. And as you rightly mentioned, from different time zones, that's the most important thing. Anyway, nice presentation. And of course, our Beatrice Madam beautifully explained how this can be blended, not by talking, but practically she showed how this can be blended effectively. Then another one, Dr. Kathy Lemon mentioned about why it is necessary. It's another beautiful, and of course, Meridian Salcedo doctor explained the technical problems that we are facing. Anyway, as rightly mentioned by everybody, the coming era will be a medicine of energy medicine. And what is desperately needed is a comprehension of the human or the common man, or the so-called politicians. They should recognize this. That's the most important thing. At the same time, everybody, especially the highly learned people, must recognize that till date there is no nanoparticle discovered as as life particle. Life is not yet discovered or invented, but everybody is discussing about this nanoparticle. So homeopathy is beyond that. So when at a juncture where the scientists were able to discover the life particles, in a living body, definitely homeopathy will get a scientific applause. Thank you.
Let me welcome Dr. Danish to add some words.
Yes, good evening all. It's a really excellent session because this kind of discussions are the need of the hour. We will have to show the world that why the eye systems are working together under one umbrella. People believe that integrated system means that a particular doctor is doing to do all these things together, but it is absolutely ridiculous. It is not the way to mix together, but instead sitting together under one umbrella and giving prescription as what the patient required. For example, a patient may be coming with case of rheumatism. He may require homeopathic treatment as well as the naturopathy food advisors as well as the yoga treatment. So all these things can bring the patient back to health in the shortest possible time. So the primary intention of the physician shall be and must be giving result to the patient in the shortest possible time and making back to health in the shortest possible time. And this is what the purpose of integration of medicine. That's the reason why Prime Minister Modi has done a great job in bringing out our yoga to different part of the world and giving how it can be mixed with your treatment, how it can be going tandem with the other system of treatment. And nowadays, people around the world are using these techniques. They are also looking forward what can be the solution. So I think that this discussion has given a very good impact upon what are the questions raised by some people. What is integration of medicine and how it can be practiced in the coming days. So the observation is that definitely the answer is that there is something great that can do that if doctors sit together. If, for example, in a medical college, ENT specialists, cardiologists, gynecologists, all are sitting together to find a solution and to a patient. But in the meantime, if different systems of doctors also sit together and work together, definitely that will yield better result than anything else. This is my observation.
Thank you. Thank you so much. And it's time to conclude. It's a vast subject. Lot of insights I got as a moderator. I know each and every person we are listening this session will be having their own thoughts, opinions, and viewpoints. Let's contemplate on that. What these eminent persons spoke, and we need to connect it with our great Master Hanuman, who taught us this great system of medicine. And I, on behalf of Ifph, like to thank Dr. Beatrix Dessner from Germany, Dr. Kathy May Lemon from USA, Dr. Marian Salcedo from Bolivia, Dr. Huan V. Ling from Brazil, and our Vice President, Dr. Shaji Varghese Kudiat from India for this excellent session. And we will meet together with new insights. Till then, bye. And I thank you all for listening and being part of this session. Thanks all.